Hi, I'm Rashida Sahas Badge, and I will be giving a general educational review of the pathophysiology and pharmacological treatment of Alzheimer's disease today. With relation to John, who is a retired farmer at the age of 80, has presented with a mild stage Alzheimer's diagnosis. An increasing loss of cognitive and functional abilities is a hallmark of Alzheimer's disease, a progressive neurodegenerative illness. Neurofibrillary tangles, the NFTs, which are made of hyperphosphorylated tau protein, amyloid beta plaque, A beta, and extensive neuronal and synaptic loss are the hallmark of the pathogenic characteristics of Alzheimer's disease. The amyloid beta hypothesis and the cholinergic hypothesis are the two main theories that supports the pathophysiology of Alzheimer's disease. According to the amyloid hypothesis, a 42 amino acid peptide called A beta 42, which is produced from the amyloid precursor protein APP, is essential to the development of illness. It is found on the chromosome 21. APP undergoes the amyloidogenic pathways beta and gamma secretase proteolytic cleavage, which result in the formation of A beta. A beta 42 is most likely to aggregate and create extracellular plaques that impairs neuronal transmission, trigger the inflammation by activating microglia, and result in neurotoxicity. The cortex and hippocampal regions are where these plaques initially showed up in Alzheimer's disease. The development of intracellular neurofibrillary triangles from the hypophosphorylated tau protein is the second distinguishing characteristics. In Alzheimer's disease, tau detaches. Clumps are formed in pairs of helical filaments, the NFTs, that impair cellular transport and causes neuronal death. Normally, tau stabilizes neuronal microtubules. The Bragg stages The Bragg staging is a predictable pattern by which the NFTs spread, beginning in the cortex and moving onto the limbic system, hippocampus, and neocortex. The behavioral and cognitive signs seen in patients such as John are consistent with this trend. According to the cholinergic theory, the degradation of cholinergic neurons, particularly in the nucleus basalis, is the cause of cognitive impairment in Alzheimer's disease. Acetylcholine, a neurotransmitter essential for memory and attention, is significantly reduced as a result. Interestingly, A beta aggregation may alter synaptic activation, which further impairs cholinergic functions. Hence, the use of cholinesterase inhibitors in treatment is justified by this knowledge. The most commonly given symptomatic treatment for mild to moderate Alzheimer's disease is donepezil, that is a cholinesterase inhibitor. The drug class of donepezil is cholinesterase inhibitor, and the mechanism of action acts by reversibly blocking acetylcholinesterase, which is the enzyme that breaks down acetylcholine in the synaptic cleft environment. This enhances cholinergic transmission in the brain, especially in the neocortex and hippocampal region, by increasing the availability of acetylcholine. The indications are licensed to treat mild to moderate Alzheimer's. In the fairly severe stage, it may be continued based on the clinical judgment. John exhibits increasing bewilderment, memory loss, and trouble completing everyday chores. Donepezil is suitable to promote the residual cognitive function in light of the cholinergic hypothesis and the existence of tau and alpha beta pathology in memory related brain areas. It may temporarily relieve or stabilize the symptoms, increasing John's independence and lessening the strains on carers, even if it does not stop the disease's course. Important nursing consideration for donepezil consists of: it should be only one oral dose each day. Ideally in the evening is a part of the dosage. The adverse effects, including weight loss, vomiting, diarrhea, and nausea, are prevalent. Brachycardia and syncope are examples of cardiovascular consequences that can arise from elevated vagal tone. Keeping an eye on the baseline, such as the ECG, especially for patients on the beta blockers or those with underlying cardiac problems, is very essential. Education for setting reasonable expectations is essential. John's wife has to be informed by nurses that cognitive deterioration will persist over time and that donepezil offers only a limited symptomatic relief. Tolerability and cognitive function must be regularly evaluated. Adjusting the dosage or stopping the medication should be considered if the negative effects outweighs the positive one. We can say that in conclusion, tau and amyloid pathology lead to Alzheimer's disease, which causes the cholinergic impairments, synaptic loss, and progressive neurodegeneration. Cholinesterase inhibitor, which is donzepil, helps in raise acetylcholine levels to support the cognitive function temporarily. In addition to providing this therapy, it is important for our roles as a nurse to educate the families. In this case, that would be the family of John. We should educate his wife or maybe John himself just to keep an eye out for the side effects. That includes nausea or vomiting. And so he can promote person-centered care, a patient-centered care, as well as the evidence-based care. Preventing the functional deterioration and improving the quality of life are the two benefits of early and well-informed pharmaceutical and pathological interventions for individuals like John. Thank you so much for watching this video.